here we have an example of the exposure control plan. This video gives an overview of the different components of what the exposure control plan encompasses. The purpose of a written program is not just to meet OSHA regulations, but to make sure that you've accounted for all the variables, and that when a person who is in charge of your exposure control plan leaves, that the replacement knows exactly what to do. As with any example of a written program, there are fields that need to be filled out. This is very important to make sure that you go through and fill in all the blanks. Starting with the program administration section, we really get into the nuts and bolts of identifying who is in charge of what, which makes this an area that is especially important to pay close attention to. Sometimes you will want to fill in the name of the person, but you will also want to make sure that if that person no longer has those responsibilities, that you change your program to reflect that. Or you can simply identify a position so that it remains current, even if that person in that position changes. Next, we have the exposure determination. Now, when you do your initial determination, you're going to want to identify which employees are always exposed to bloodborne pathogens, employees who are sometimes exposed to bloodborne pathogens, and you're also identifying tasks that can expose employees to bloodborne pathogens. So, here's where you would want to include the job titles of people that could have that type of exposure potential. For example, a phlebotomist can't draw blood without being exposed to blood. In methods of implementation and control, you begin by stating what level of precautions your program is following, whether you are following universal precautions, standard precautions, or body substance isolation. This is where you want to say that. You want to identify who is responsible for keeping this program up to date and who is responsible for reviewing it annually. The exposure control plan talks about the person, job title, department, or whoever is responsible for making sure that the initial training for employees is completed and that the plan is annually reviewed. In engineering controls and work practices, you identify which engineering controls your company uses, and that's also going to include your Sharps devices and your safer medical devices. This is going to include what you are going to do with Sharps containers for used Sharps. So, if there is a specific work process that needs to be followed for a particular task, this is where you would want to identify that. Now, this section deals with personal protective equipment, or in short, PPE. Now, what kind of PPE do your workers use? Clearly with this, it depends on what tasks your employees are doing. This can just be an overview of the program of what PPE is available. You want to say where it is and who to speak with to obtain the correct PPE. And then you have your specific practices for how you use it. Now, you need to plan how you're going to dispose of that equipment when needed, especially if it is soiled or contaminated. Because, that's not something you can necessarily just dispose of in the normal garbage. You may need to clean and decontaminate it first, or you may need to have distinct biohazard containers. If it can break, or if it's sharp, it may need to go into a Sharps container. Now, there isn't a lot of PPE that would need that, but you've got to consider it. On to housekeeping. This section mainly deals with regulated waste. What do you do with your used Sharps and regulated waste? Where does that go? Housekeeping is concentrated on waste and cleanup. And in laundry, what articles are going to be laundered routinely by an employer? Whether you sent it out or it remains on site, you need to identify that, so your program clearly identifies the protocol. The labeling section covers who is responsible for making sure that contaminated or infectious items are clearly identified as such. Some instances will require biohazard tags, and others just a label saying what is in the container. So you want to make sure that you have two clearly identified places of what goes where, so everyone is on the same page, and whoever is responsible for making sure that those things are done so that if there is a problem, your written program clearly identifies who you need to talk with. With the hepatitis B vaccine, you want to ensure that someone is in charge of administering it, so making sure there is someone who's responsible for getting everyone informed of the vaccination is essential. Possibly one of the most important sections of the written program is the post-exposure evaluation and follow-up. Anytime there is a needle stick, there are steps that must take place at the earliest convenience. If somebody has a needle stick that may carry HIV, they need to start treatment within 2 hours of that exposure. That gives them the best possible outcome. The timeliness on this is critical. Again, it is very important to identify who is responsible for reporting needle sticks and where the injured are going for treatment is also imperative. There are specific things that need to happen as a part of the post-exposure evaluation. The employer is responsible for making sure that all of this happens. They don't necessarily need to do every step, but they do need to make sure that every step is followed. There are other aspects to this as well, like counseling and source individual testing. So, in essence, the post-exposure evaluation and the administration of that clearly needs to identify who, what, where, and when.